Here we have a case of another nurse fumbling the bag once again. And I hate this is starting to become normalized because, it's like you see it all the time and you hear it all the time, but I'm sure it's been going on since the beginning of time. But let's talk about it.
You can live pretty well by yourself.
What's good, everybody? It's your man CJ, aka the High Value Nurse, checking in once again, back with another video. Now, unfortunately, ladies and gentlemen, we have some news that is not too good. Now, a former ER nurse has been sentenced to 3 years in prison. But before we get into that story, I would like to take this time to invite you all to subscribe, hit that like button, hit that notification bell so you don't miss any of the content that we have here on the channel. It costs you nothing, but it helps the channel out. Thank you in advance. Now, a former ER nurse is sentenced to 3 years in prison, ladies and gentlemen. What did she do? Well, she was stealing narcotics. And I talk about this a lot on my lives, and it's nothing new. But I'm always reminded of how this game is, and it's a reminder of people's mental state when getting into this game, while in the game, and after leaving the game. And if you don't know what game I'm talking about the nursing game, obviously. But it's just another sad situation. And now this nurse has just fumbled everything that she's working for, but it's due to addiction. Let's get into the story. The story can be found pinned to the comment, first comment pinned to the top, so you can check it out for yourself. But you have me to give it to you in this video audio format. Let's go. A former emergency department nurse at Franciscan Health in Crawfordsville, Indiana, was sentenced to 3 years in federal prison for tampering with patient medication, ladies and gentlemen. Jennifer Adams, 38 years old, of Indianapolis, was accused of tampering with injectable pain medications, including fentanyl, morphine, ketamine, and apparently a lot more, from October 2018 to February 2020, while employed as a registered nurse. Now, that is a very long time to be going around stealing medications, especially not getting caught. And they were also saying that not only was she stealing medications, but she was taking the patient's medications, gluing the vial back together, and injecting the vial with saline and giving them to the patients. Now, I'm sure that the patients were probably like, this must be the cheapest morphine, fentanyl, ketamine on planet Earth, because saline does not take pain away, ladies and gentlemen. Let's keep going. According to a release made by the United States Attorney's Office Wednesday, Adams gained access to the medications without authorization and used them on herself with an aid of an automatic medication dispensing machine. So my question is, was she using this at work? Did she wait till she got off work? You dig what I'm saying? She was using them on herself. Were there not drug tests given? I could probably count on one hand when we were required to do drug tests for a job, and I've never had one done during a tenure, like in mid-tenure of a job. So that might be, the reason why they never caught her. But I'm sure she probably came to work high at some point, so who knows? According to a release made by the United States Attorney's Office Wednesday, Adams gained access to the medication without authorization. Adams, after using the medications, refilled the vials with saline and superglued the lids back on, investigators say. Adams then proceeded to use the tampered medications on 30 to 40 patients in need of pain relief. Again, they're probably saying this must be the cheapest morphine on planet Earth. Indiana Attorney General Todd Rokita said in a statement, quote, most healthcare workers are heroes and work very hard to save lives. But when one person decides to abuse this power, patients suffer tremendously. And I agree. I definitely agree with that statement. In this statement, Rokita Also says this behavior from healthcare professionals is unacceptable. We should be able to trust our doctors and our nurses and not have to worry about tampered medication. Rokita said, yeah, they're 100% right. The block is continuing to be hot. And this just made it a whole lot hotter. And I'm just like, this is kind of crazy. You dig what I'm saying? Like, why would you risk it all once again? But when people have addictions, then, you know, sometimes they can't help themselves. So, another question that I throw out to the audience: should this woman go to prison, or should she be given treatment? Because clearly she has a disease. It's an issue. What should happen to her? How should she pay the consequences? Should they take away her nursing license? Should she be able to practice again? What do y'all think? United States Attorney for the Southern District of Indiana, Zachary Myers, says in the release that he encourages any healthcare officials struggling with substance abuse to seek help. Adams was ordered 3 years of probation and supervision after her release from federal prison, and also ordered to pay a $1,000 fine. Now, the article did not say if she's going to lose her license or not. I don't know what the Board of Nursing for that particular state is going to do, but who knows at this point? Should she lose her license after being helped, if she gets help, and after she's recovered? Hopefully, should she be able to practice nursing again? Let me know what you think in the comments. I'm curious to see what y'all have to say. So, anyway, ladies and gentlemen, my name is CJ, aka the High Value Nurse, checking in once again. And if you do nothing else, get paid, young nurse. Get paid. Peace.